welcome. I wanted to take a brief moment of your time today to explain some new and exciting components of our new and electronic health record system. Many of you have anxiously been waiting for the launch of this, and I'm thrilled I can finally bring you some information on how it can benefit our team. I would like to take a moment to briefly introduce myself. My name is Kiri Rush, CEO for ABC Medical Center, and I have been with the organization for more than 20 years, and I am beyond excited for our rollout of the system in January 2019. I wanted to thank each and every one of you for your hard work and dedication to this company, and I look forward to our future growth. This new electronic health record system will allow us to think outside the box and keep the patient at the center of our focus. One major challenge for ABC Medical Center has been trying to improve over the years is patient engagement within our facilities, among our care teams, our physicians, and our administrators. Electronic health records allow of systematic collection and management of patient health information in a form that can be shared across multiple healthcare systems. So what is patient engagement and why does it matter? Patient engagement fosters trust between patients and the healthcare professionals treating them and is key for maintaining continuity of care. Engaged patients will have a more positive attitude towards the practice and the staff who treat them each and every day, and that is you. We want the patients who are seen at ABC Medical Center to feel as though their healthcare is important, and we want providing all the necessary tools to give them the best possible outcome. So why is it so important for ABC Medical Center to engage the patients in their own medical care? So number one, this leads to patient-centered medical home recognition. So PCMH for short. This puts the patient at the forefront of care, which we all know is the mission here at ABC Medical. This builds better relationships between our patients and the care teams. Practices that earn the recognition have made a commitment to continuous quality improvement and patient-centered approach of care. Number two, this impacts the patient retention. So based on a study conducted between 2005 and 2008, patients who use the patient portal are nearly 2.6 times more likely to stay patients, which we know that we all want for our organizations. So number three, this impacts the chronic condition management. So patient access to information and direct communication with providers can increase the quality of life. When patients are fully engaged in their care, they are more likely to maintain treatment plans, track their health, and ask their provider questions. Number four, so this supports a timely access to care. So patient portals offer benefits to providers, including reduced call volumes, improved responsiveness to patient needs, decreased utilization of health services, more effective care, and cost savings. So finally, number five, this leads to better health outcomes. So encouraging our patients to participate in their own health care can result in a better preventative care and improves medication adherence. So now that we've discussed why patient engagement is so important, let's jump into the very exciting key components of our new electronic health record system and how it not only benefits our staff, but also is a game changer in the way that patients are involved in their own care. So one of the keys to a long-term good health is taking appropriate preventative measures. So regular preventative care like getting your flu shot, mammograms, colonoscopies, breast exams are all important steps to avoid disease and stay healthy. So with our new electronic health record system, if a patient is, let's say, due for a vaccine, providers are able to see alerts on the system, and patients are able to receive messages via MyChart, or let's say a text message reminder on either their phone or if they have a handy dandy iWatch. Providers also have the ability to view vaccinations performed at, let's say, another facility right in the patient's charts. And patients do have the ability to report any vaccines they may have got at another facility right in MyChart as well. Patients will also have the option to view educational materials on the specific vaccines and where they might be available to receive. If for some reason a patient is not able to get that vaccine at a normal doctor's visit, the physician now is able to electronically provide that vaccine where the patient is able to get that anywhere that it is available. Another cool feature about our electronic health record is the ability for our patients to communicate with doctors and other staff members via secure email. Who hasn't dreaded calling up the doctor's office to ask a quick question or to clarify something a doctor or nurse said earlier during that visit? The system now allows patients to freely communicate with doctors, nurses, and other staff members via email safely and securely. This has the ability to cut down on the time staff spends on answering phone calls, typing messages through a physician assistant program, and following up on calls that can now be done through the system. Another great feature is the ability to set up appointments online and get reminders. The system is great for a busy parent on the go that just doesn't have the time to sit down, make a phone call, and schedule an appointment for her child just to go see a doctor. With our new electronic health record system, it allows someone on the go to set up appointments that are easy and convenient for them through their busy schedules. The system will even allow you to record audio reminders in the voices of actual staff members, which is pretty cool. Sometimes we don't like to listen to ourselves talk, or sometimes we do. But we may, like to hear the physician or someone at the doctor's office set that reminder appointment for us via an audio recording. That way we may be more tempted to go. This new electronic health system allows our physicians to prescribe, medication, chart anywhere with an internet-connected computer, tablet, mobile device. It cuts back on medication errors, allergy errors, and so much more. ABC Medical Center is going to launch a better online presence. That way we can build our reputation with the community that we serve. So through Facebook, Twitter, and a few online blogs that a couple of our physicians have so generously offered to start, we are now able to reach patients on a much greater spectrum. So through this new online feature, our patients will get up-to-date information about our clinics, any new health watches to be aware of, like let's say that recent romaine lettuce scare, and then the turkey with the salmonella, or just some tips and tricks just to stay healthy throughout various times of the year, like flu season. For those that may not get online often, there is also an option to get signed up with a monthly newsletter that can either be mailed or emailed to patients upon request. There are just so many exciting features and not enough time to go into detail on all of them. I encourage you to get with your leads and supervisors before the launch to go over any necessary training and education you may need. If you have any questions or concerns, please feel free to reach out. Remember that our patients are at the forefront of care, and we are here to provide quality and safety to all. Thank you again for your time, and you guys have a wonderful rest of your day. Thank you again. Bye-bye.